Welcome to Benita's Maternity Program webinar. Today we're speaking with Sister Ingrid Groenewald, who is speaking to us about skin to skin with your newborn. Welcome, Sister Ingrid.
Thank you very much. I'm very happy to be with you again today. And today I even brought my own baby. So meet baby Erica. I must say she's well behaved. So she's actually doing always she's sitting quite quietly, let me talk. So for real, sometimes that does not happen if you have a real baby. But yes, I am happy to be with you here today. So today we're talking about skin to skin and what exactly that is. So to some of you, you might have heard the term before. Some people refer to it as kangaroo mother care, and other talk about skin to skin. So let's just take one step back and say, when you are pregnant, and some of you are pregnant currently, I suppose most of you are currently pregnant, preparing for the birth, thinking about how it's going to be afterwards, becoming a mother. But let's think about your baby currently in pregnancy. What actually happens? Your baby is in such a wonderful world. Your baby is inside of you. You are providing food for the baby. The baby is getting warmth through you. Your baby is getting protection from you and is also getting oxygen from you. So the baby really loves that environment, and that is why it's really good for the baby to be there. Then what happens after birth? Okay. Suddenly everything changes to the baby. Suddenly it's much colder. So even if we think about the temperature today, even if you are where you are, you've got a 30-degree temperature, let's say, it is very hot for you, but for your baby, it's quite a dramatic drop of temperature. So it's about 38 degrees in there. So there's a very big drop of temperature directly after birth, and in most cases, it's not even 30. I would even say to 20 to 25. That is about a very common kind of temperature. If one thinks about hospitals and the rooms and so on, that it's a dramatic change in temperature for baby. Okay, so that is different. The sounds that the baby hears is different. And then suddenly everything being touched, like we touch your baby, how you touch your baby, that is also very different to baby. So it is very stressful for a baby to be born. So what do we know? What is best for the baby? Okay, so this is really where research has been done, and this comes with a lot of research behind it. The best thing that you can do is to hold your baby and to do skin to skin. And let me tell you how to do this practically, and then we're going to look at the benefits and why this is important. Why can't we just put babies in incubators or put babies somewhere in a bed to sleep directly after the birth, for a couple of weeks? Okay, so let's see. If you have your baby, I already undressed my baby. So obviously if your baby was just born, the baby's not going to have any clothes on. The cord is still going to be attached to the baby. And then there's also no hat initially on the baby's head. And then the ideal is that the baby is then basically placed on your chest like this, obviously without your shirt. So I would say take off your shirt, place baby skin to skin on your chest like this. This has a lot of advantages to baby. It immediately starts to relax and to calm the baby. It brings the stress hormones down. It heats the baby. All these things happen with your baby on your chest. Luckily, we have seen the light, if one can say it like that. Research has shown us that incubators for normal full-term babies are actually not the best place for a baby to be. The mother's chest is way better, okay, because there are so many things happening here. Okay, so this is what you want to do directly after birth, and you want to have your baby skin to skin on your chest for at least an hour, or at least until the baby started to feed, so that you breastfeed and that the baby actually started feeding at that time before the baby's taken away. And then it is actually a good idea, I would say, to continue with skin to skin care as long as you can, every day, to take some time away or some time out that you say, now you're going to undress your baby. If you feel really adventurous, you can take the nappy off as well. Otherwise, you can fold the nappy small and you can just keep your baby skin to skin like this on your chest. We know it's really good. The best thing is if it's the mother, but sometimes the mother is also doing some stuff. You are perhaps bathing or you need to sleep a little bit, and then somebody else can actually take over. And this is really a good bonding experience for the dad. So I would say that the dad can actually also take the baby, take off the shirt for the, the dad takes it off, places baby on the chest like this. And then obviously, if it's cold, you can just take a blanket or something and just cover the baby like that. Okay, so this is really good bonding experiences for the father as well. Okay, so let's see what happened, and what kind of research is out there. Quite interesting is they did quite a big study in Israel, which is a long-term study that they did on many, many babies in ICU, in NICU that were born. And then they looked at them and they followed them throughout for 10 years. And it's something that's really interesting to note is that these mothers and babies do exceptionally well. It's very different to the babies that are born and the mother never had the baby skin to skin. So in reality, often, especially with a premature baby, it's often that babies eventually are placed on the mom's skin to skin like this, which is really great. But it's obviously an advantage, not just for the premature babies, but also for full-term babies as well. So what they found is that 10 years down the line, that these mothers had really good bonding experiences with their children. So the relationship between the mother, specifically the mother and the child, was way better, interestingly enough, compared to if the mother did not do skin to skin. The maternal attachment behavior, the anxiety of a mother, was way down. So these mothers actually coped really well in the early childhood up to 10 years. So that is where they basically stopped with the study. So all in all, from the mother's side, it was really a good thing to have done. And then by looking at the child, these children, they definitely had an advantage that their cognitive behavior and their development was definitely very different and enhanced to the ones who did not experience the skin to skin. So we can see that there are some definite advantages, and to this day, there's a lot of research going on about this. Okay, so let's see, what are the immediate benefits? So if you have a newborn baby and your baby's born, perhaps your baby is a little bit sick, and you're sitting in ICU and you have your baby on your chest, or your baby was born premature, and at some point you will become, you're going to sit in ICU and they're going to put your baby on your chest like this, or your baby's full term and was just born. What happens if you start doing the skin to skin? So we know for a fact that the heart rate and the lung function stabilizes. So immediately, if we think about birth specifically here, the baby, so much has changed for the baby. And immediately, if you put your baby skin to skin on your chest like this, very quickly, the heart rate stabilizes. So it's not all over the place. It definitely starts to stabilize, which is really great for the baby. Another thing that is very, it's an actually amazing thing to know is that the temperature of the baby also stabilizes. And what actually happens is that the mother's core temperature goes up with 2 degrees if you have your baby on your chest like this, without you even knowing what you're doing. Your core temperature goes up. So if your baby is lying skin to skin on your chest like this, immediately you are becoming like a heater to your baby. So your baby's temperature goes up. If your temperature of the baby becomes too high, your body temperature goes down again, and that lowers the baby's temperature. And this keeps happening up and down until it stabilizes. They have tried this with other people, with the father, with siblings, grandparents, but that person just warms the baby. The mother's temperature, however, goes up and down according to the needs of the baby. Isn't that amazing? Okay, so guys, really, this is something that you have to do when your baby is born. Remember this, skin to skin, it is such an advantage, not just to you, but also definitely to the baby. Then another thing that in hospital, often people perhaps don't know this, but the baby's blood sugar is often tested. So these are little heel pricks that are done on a regular basis to test the baby's blood sugar. So it can be very stressful, and especially if you think this baby's blood sugar is too low and then they're stressing about how's the baby feeding and all these things. And what we know, if a baby is placed skin to skin, it also settles and it also regulates the blood glucose. So in actual fact, you're helping that, okay? So it's not just for the birth, for the whole time period that you are in hospital, I would actually advise you, just keep your baby on your chest, skin to skin, okay? Undress the baby. You want that skin contact, okay? So you can just undress the baby, have your baby on your chest, on your bare chest, and then you can take a blanket and so on that you can put over the baby, okay? Then another thing that is an advantage if you do skin to skin with your baby is that the initiation of breastfeeding is a lot easier. Okay, so if your baby is placed skin to skin, there are some instinctive behaviors that the baby follows directly after birth. And we know now that there's a lot of interference sometimes, and that causes a bit of confusion sometimes to babies. If a baby is taken away from the mother, even just wait for a couple of seconds and then given back to the mother, that interferes that instinctive behavior. So what we recommend is that the baby is placed skin to skin directly after birth, and there the baby stays until the baby wants to start feeding, and then you can help your baby to latch the baby and baby starts feeding. That then is like the good path. It makes everything easier for a good breastfeeding relationship. So you don't want to interfere. You don't want to take this baby away before the baby actually started with the first feed. Okay, so if you do skin to skin, the possibility that this is going to happen is so much bigger. Okay, so really, really good for the baby. Then what we also know is that the baby, once born, is suddenly bombarded with lots of bacteria and viruses and things going around in this world. And it is always better that the first bacteria that reach the baby, if that can be the mother's bacteria. That is why natural birth, vaginal birth, is so important to know of this. But also, if that is not the case, if you had to have a cesarean, the skin to skin like this will also help, because your bacteria that is on your body is going to be transferred over to the baby. Okay, so you want the good bacteria of mother that is going to go and colonize within the baby's guts, okay, and in the baby's system. Okay, so we want to expose the baby to that. Okay, we also know that if a baby is carried a lot, and if a baby is skin to skin, so even later on, a couple of days in, you're at home, you carry your baby skin to skin, you might even do a boob tube, or you might just have a wrap around baby. Some big scarves or blankets or towels work well, where the baby is skin to the mother. We know these babies actually cry a lot less. Okay, that I think is a very modern thing, to think that babies have to lie somewhere alone in a bed. Okay, it's quiet, it's cold, it's very different to the world where the baby came from. Okay, so you want to keep the baby close to also have the baby calm, because if a baby is calm, mommy is calm. Okay, and you actually in actual fact helping yourself. Okay, so just by keeping baby close to you, that definitely helps as well. We also know skin to skin helps to reduce any kind of pain that the baby is having. So if your baby is lying like this, especially later if your baby perhaps is sick or so, hopefully that's not going to happen. But if your baby is sick, by having your baby skin to skin, they actually they get healthy quicker. And then also, any kind of pain that the baby is having is actually a lot less. Okay, so you're actually helping. You are basically like your baby's pain medication. Okay, so just by keeping your baby like this will actually help. Then also the connection between you and your baby is really very good. We know that all in all, it is fantastic to have your baby skin to skin. Okay, so now that you also know this, and also the hospitals know this, it is important to tell people that this is what you want. If you're pregnant and you're going to hospital for the birth of the baby, to tell them, I want my baby not taken away. Place your baby once baby's born directly on your chest, and now you hang on to your baby. Okay, I'm talking about a healthy newborn baby. Okay, so this is the ideal place, because it regulates everything and the stress hormones come down and so on. Should you have a premature baby or a baby that is in need of special care directly after birth, they are often taken to an ICU. And then once you can go there, depending on how many weeks in the baby is, how old the baby is, and how the baby is stabilizing. But there comes a time when you can start doing skin to skin, where you can start doing the kangaroo care. And it's really excellent for premature babies to be able to do this. If you do currently have a baby that is premature, perhaps ask the nursing staff there and the pediatricians, when can you start doing skin to skin, because you know of the advantages. They actually found the advantages. This is how it started, by a hospital in an African country where they didn't have a lot of money in the hospital. They didn't have a lot of incubators in the hospital. And there were so many low birth weight babies, or birth weight babies that were very low, and they were sick. And they kept on, at that time, we all believed that babies were placed in incubators, but they weren't enough. And because of desperation, really, they got the moms to sit on chairs and just to pop these newborn babies on the chest. And then after a few days, they started noticing that these babies are doing better compared to the ones in the incubators. They gained more weight. They just all in all did a lot better. And this is what really sparked this. So luckily we live now where we know the advantages of having your baby skin to skin. So I hope I taught you something today. And if you are pregnant, that you can know, you can ask for this and you can say, this is what I want. And then once you go home and you are home in your own environment, keep on doing skin to skin. You don't have to do 24 hours of 24 hours. Even every minute that you can do it is great. So if you can say, like, let's say in the first couple of days, once, let's say 1 hour a day, if you can do longer, that's fantastic. That you can just pop your baby on your skin. If it's cold, put a little beanie on, put a blanket over. And this is really the best kind of cuddle that you can have with your baby. You are helping your baby and you are helping yourself. Okay, so I hope I taught you something. I don't know if there are any questions, perhaps. If there are questions, feel free to ask them. You can type them, or we can, or perhaps you don't have any questions. I don't know. Are there any questions, perhaps? Let's see. Any questions regarding skin to skin or a kangaroo mother care? But it is really great, often a question what I often get is, so how long should I keep this, baby skin to skin? For how long should you do this? And it really doesn't matter. It doesn't matter however long you can in your situation, but every mother should be given the chance to do this, definitely after birth and then in the hospital stay. And then once you're home, you're in your own environment, and that's a really good time where you can actually start doing more skin to skin, and you can get the partner or the father present as well, and you can actually also help him to start doing skin to skin. I think sometimes the dads are very left out, and this is a way for him also to actually bond with his baby, so if you have the baby on the dad's chest like this, it definitely helps to also form a relationship with the father, and we know that that is a very important relationship to also have. Another question that I often get is, how do I practically do this, at home? Do I always have to lie in bed doing skin to skin? And in actual fact, there also you can. That is great. You can rest like this. This is really fantastic to be able to do that. But you can put your baby skin to skin like this. And then if you have like a boob tube that you can put over, or you can take a long scarf and you just wrap your baby around yourself and just make a knot in front under the bum of the baby. That actually keeps the baby secure as well. A lot of people use towels, which is also great. You can use that if you've got a big towel or a blanket. Or then like these slings or the wrap, if you have a sling or a wrap or a baby carrier, you can also get those closer and just see what can you do to actually use that for your baby, to carry your baby like that. And you can do this for weeks in months even, so it's really, at the end of the day, you read your baby and you get to know your baby. And that's another advantage, that you actually start to know exactly what your baby wants. You start being able to really understand the baby's language, okay, if your baby is always close with you.